taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike LeNoir and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the African American Wellness Watch. I'm your moderator, George Strait. On this special edition of the Wellness Watch, we have a true American hero as a guest, Dr. Anthony Fauci. For 38 years as director of the National Institute of Allergy and Infectious Diseases at the NIH, Dr. Fauci led the fight against the infectious diseases that threatened the U.S. and the entire world, from SARS to Ebola, HIV to COVID. Dr. Fauci has been at the forefront, leading a team of scientists to mitigate the threat, but also explaining to presidents and all of us how to deal with it. I first met Dr. Fauci in 1984 at the beginning of the HIV epidemic, when we both had less hair and much less notoriety and more hair. Tony, it's an honor.
Thank you, George. Good to be with you.
As always, our host is Dr. Mike LeNoir, practicing physician and former head of the National Medical Association. Mike?
Well, I want to welcome you, Dr. Fauci. To us, you are a real hero through the HIV epidemic and certainly through COVID. I've met you in a number of capacities, both as an allergist and one time a clinical immunologist and as president of the National Medical Association. So I feel I can speak for our whole organization and say thank you. But first, how are you? I know you had to deal with the West Nile virus. How are you doing?
I'm doing fine, Michael. I feel that I'm very lucky because, West Nile virus is a very serious disease. I got terribly ill. I think the sickest I've ever been in my life by an order of magnitude. But fortunately, I've been able to recover essentially completely, which is not always the case with people my age who get West Nile. Very often they have residual neurological abnormalities, and I fortunately have not had that, which I feel that I actually am very lucky. But I'm back in action again. It was a terrible ordeal. Got bit by a mosquito in my own backyard in the middle of Washington, D.C., which you wouldn't think would happen, but it actually happened.
Well, is the West Nile virus something that the rest of America should be concerned about?
I believe so. I believe it's a much underappreciated mosquito-borne infection. It is the most common mosquito-borne infection in the United States. There was no West Nile virus before 1999. It came over very likely on an airplane with either a mosquito or a bird or someone who was infected in 1999. And since then, there have been variable numbers of infections, probably measured in the hundreds of thousands, because 80% of the infections are without symptoms. So there are a lot of people out there who get infected with no symptoms. 20% of them get some symptoms, and a percentage of those, about 1 out of every 150 people, get serious enough symptoms to have a major impact on their lives, such as what happened with me. So the answer to your question, Michael, is that it is much more common and much underappreciated in the United States. And that's the reason why when I wrote that op-ed in the New York Times, soon after my recovery, I called for a lot more attention and resources into developing a vaccine and antivirals, if that's possible.
Yeah, well, I know you must have been quite surprised when the diagnosis came through, but let's move to a more a common problem. I'm sure 99.9% of people in this country, and I'm exaggerating a little bit, think that COVID is no longer a problem. And yet we still see cases, and there are deaths from COVID. And as I understand it, last year, there were more COVID infections than there were flu infections. What should the public be concerned about with COVID now?
Well, the fact is that, as you said, it is still with us. If you look at the CDC estimates, and they're really only rough estimates, there were, 250, 225,000 infections just in one day, yesterday and the day before. Since this virus has been around now since 2020, since the very beginning of 2020. Almost everyone in the United States has had some experience either having been infected and or having been vaccinated. And so there's a degree of background immunity, even though new variants occur, which escape the protection from either prior infection or prior vaccination, so that the protection against infection is not particularly durable. The good thing about vaccines is that they protect you pretty well against severe disease, leading to hospitalizations and deaths. But even having said that, even now in our 5th year of the outbreak, the deaths from COVID are more than the deaths per year from influenza. So even after all this time, it's still a more serious threat than is influenza.
What is the immunologic mechanism that allows you to be partially protected from death and serious illness that makes these vaccines so effective?
Well, what it is that it's a systemically administered vaccine. So much of your protection are in immune components throughout your body, in your lung, in your spleen, in your lymphoid tissue. The upper airway, the protection there wanes pretty quickly. In order to get really good protection from actual infection, you have to have a sustained level of antibodies, usually IgA antibodies, in the mucosal surface of the nose and upper airway. But that kind of protection is rather transient, whereas the protection systemically against pulmonary disease or against systemic disease lasts much longer. And that's the reason why we say, even though vaccines may not very, very much protect you against initial infection, it does a pretty good job of protecting you against severity of disease.
One of the things that I think we all need protection from is misinformation about COVID. And as you know, Dr. Fauci, African Americans seem to have been disproportionately affected by this misinformation. So what's real, what's not? What's real about COVID, what's not? What works, what doesn't? And where should we get the kind of information that we can trust?
Well, the one thing that's very clear, George, is that with regard to misinformation, vaccines have saved literally millions of lives. I mean, the Commonwealth Fund did an estimate that in about a year and a half, from 2021 to 2022 or something like that, within about an 18-month period, that vaccination saved 3 million lives in the United States, 18 million hospitalizations, and over $1 trillion in healthcare costs. And when you do a global study, it saved about 14 million lives. So if you want to say what's right, what's wrong, what's true, what's not true, what's true is that vaccines are life-saving. The other thing that's true is that African Americans and Hispanics, to a lesser extent, have a higher degree of underlying conditions that once you do get infected, it makes it more likely that you will have a severe outcome leading to hospitalization and perhaps death. And what I'm referring to is the greater degree among minority populations of diabetes, hypertension, obesity, chronic lung disease. Those are all the social determinants of health, which are really, go back, as you know, George, decades, if not centuries, due to a whole variety of sociological factors of lack of access to health care, discrimination, racism, all the things that go into those social determinants of health that make minority populations more susceptible to a severe outcome.
Dr. Fauci, let's move on to HIV. There seems to be a notion in this country that HIV is pretty much cured. But does it remain still a major problem?
Well, you're absolutely correct, Michael. the good news about HIV is that we have absolutely spectacularly effective therapies. Right now, if you give someone a single pill containing 3 antiretroviral drugs and give it to a person relatively early in the course of their infection, you could tell them that it is very likely that they will live essentially a normal lifespan, perhaps a year or 2 less than the national average. So therapy has been spectacular. However, we still have, 28, 30,000 new infections in the United States per year. In the world right now, we've had a total of about 88 million infections, about 40 million deaths. And now about 29, 30 million people are receiving antiviral drugs globally, but about 10 million don't have access. So you're talking about a considerable gap in accessibility to therapy, and yet we still get, a million new infections a year, which is really not very good at all.
Well, I think that one of the things that drives that misconception is the commercials that we see, people at parties and barbecues, and it almost makes you want to join the party. I mean, they're very upbeat, and there's very little discussion about the danger it still poses for citizens in our country.
Yeah, you make a very good point. It makes it look like it's okay to get infected. I can tell you that if you look at anyone who's infected who requires taking daily antiretroviral drugs, they would all tell you they would much rather not be infected. And that's the reason why things like pre-exposure prophylaxis, which is highly effective in preventing the acquisition of HIV, is really not fully utilized. And, getting back to the point you made, George, about African Americans and Hispanics, if you look at the accessibility and the utilization of pre-exposure prophylaxis, comparing whites with African Americans with Hispanics, African Americans have a much less uptake and utilization of pre-exposure prophylaxis. And that's probably due, at least in part, to the lack of accessibility of adequate health care due to any of a number of factors, including stigma.
Thinking back to when we were both young, and HIV, but overall, despite the access issues that continue today, and despite all the disparities, it seems to me that HIV is really a public health success story. You agree?
Oh, it's a phenomenal success story, absolutely, and much, much, much more in the arena of therapy. I mean, if you look at, when you were interviewing me, George, back in 1984, I was desperately taking care of desperately ill, almost exclusively young gay men who, by the time they got to realize that they had this disease, they were very, very far advanced in the course of disease and would have a lifespan measured in 10 to 12 to 15 months at the most. And, we had no therapy in 1984. It wasn't until 1987 that the first drug, AZT, was available. And even that alone, as a single drug, did not do the trick. Fast forward to today, when you can give someone therapy and they can live essentially a normal life. It absolutely, as you say, is one of the true medical and scientific success stories. The thing that we have to do better at is in getting prevention modalities and treatment for those who don't have access to adequate health care. So it's more of an implementation problem than it is a scientific problem.
If you think back and think forward, what lessons do you think you learned personally as a researcher during the crisis, specifically lessons concerning the relationship between researchers like you and those most directly affected by your research?
Well, I recently published a memoir, George, and a major part of that was my discussion of my interaction over years with the AIDS activist community. And the lesson that I learned, and it was very cogent lesson during the HIV, particularly in the early years, is the embracing of the afflicted and at-risk community to get from them their take on what the best way to approach this among their constituents. The idea of accessibility, the idea of input into the design of clinical trials, the regulatory restrictions of the FDA, which have now, once they've been loosened, allowed the availability of life-saving drugs much earlier than they would have been available. So there are a lot of lessons about embracing the community, which can have a very positive input into how we approach the disease.
As you said, you talk a lot about that in your book, and over the summer I did read On Call, and I recommend it to all of our viewers. It's really a remarkable memoir. I mean, who knew that Tony Fauci was also a classic scholar and went to the cross? I wonder if Jack the Shot Foley was at the cross when you were there, but
he was in my class. He was in my class, Jack.
There we go. There we go. I actually grew up in Worcester, but I was particularly intrigued in the book. But sort of, it's an acknowledgement of how a very simple organism like HIV can intellectually humble really, really smart people, but also how the implicit trust that doctors assume that they have with their patients can get tested in public health emergencies.
That is true. And we saw that very clearly in COVID, when you have an emerging outbreak in which it's an unfolding situation. It's not static. And new information, new evidence, new data becomes available sort of in a rolling rollout, so that scientists do their best to use the information they have at that time to make recommendations and guidelines and suggestions. And when that information changes, the scientific process, which is self-correcting, would really compel you to perhaps modify or change your recommendations. Unfortunately, that has led to a distrust in science because the public has the impression that it's a static situation, that nothing changes. It's like mathematics. 2 + 2 = 4 today, and 2 + 2 = 4 100 years from now. That's not the case when you're dealing with an evolving outbreak in which information does evolve and change over time.
Dr. LeNoir, I know you've written and talked a lot about this trust deficit and how to address it.
Well, I think there are a couple of things. One is that Dr. Fauci made the point that the public receives a variety of different kinds of information, and they seem to take the advice of people that they trust. And they may not be scientists, they may not be doctors. And so I know that has to change, because this is not the last of the pandemics that we're going to face sometime now or in the future. But what really bothers me more than anything else is that the physician community has not done very much to connect themselves to those communities which they seek to provide. What happened in this epidemic is that large managed care operations, both in the public and private sector, just came to people they didn't know, communities they were taking care of, but they were never engaged in, and expected them to trust them with advice. And I would say that we need to build within our physician communities a connection with the people that we serve, more than just seeing them for a telehealth visit or an emergency or a routine physical.
I agree with you absolutely, Michael. That's absolutely the case. And we, when we started to really make progress with the predominantly gay population with HIV, it was when we reached out and essentially dealt with them on their own turf and on their own terms. It was much, much better to, and we gained a lot of trust and confidence in that relationship that we developed. But you're absolutely right. When there's the dissociation between the public health officials and scientists and physicians and the afflicted community, there can be the danger of the evolution of mistrust.
Well, Dr. Fauci, this has been a wonderful conversation. I want to thank you, and I think that I speak for everyone when I say not only thank you for your service to our country and to our world, but especially to your scientific rigor and transparency. We are all in your debt.
Thank you so much, George. Appreciate it. Good to be with you. Thank you, Michael.
Dr. LeNoir?
Oh, no, well, I certainly would like to thank you for taking the time and for all the contributions you've made, both known and unknown, because there are a lot of things that you're known for positively way before the HIV epidemic. We have fought the good fight through the pandemic, trying to get to our communities that we know, and with information which is not only effective but contemporary, so that we have built kind of trust within our sphere of influence, and we will continue to do this, and conversations like this will really help us. So, George, thank you for putting this together. Dr. Fauci, thank you for joining us. Solomon, of course, thank you for your technical expertise. And always remember, as George is about to laugh, that health is your biggest asset, so protect it.
Thank you.
Thanks, guys.